Can anyone hear me? I can't hear anything. You can hear me? Okay. Okay, there we go. Okay. Does it look like everyone's there? I can't tell.
Yes.
Okay, I'd like to call to order the Mundelein Elementary School District 75 Board Meeting for Tuesday, January 19th, 2021. Will the secretary please call the roll?
Holly,
Here?
St. Clair, Gallegos, Bryce. I'm not hearing everything, so okay, thank you. Fingerhut here, Erickson,
Here.
DuPont,
Here.
thank you.
Okay, the first item on the agenda is citizens' comments. I understand that we have someone at the boardroom that wishes to just address the board. Please let me remind you that typically the board will not respond to your comments, but we will listen to them. And board policy dictates that you have a time limit of 3 minutes to address the board. So please tell us your name before you start.
Okay, thank you. Good afternoon, everyone. My name is Jody Catanese. I'm a parent of a first grader and a third grader in D75. And I'm here today to support the recommendation that we vote yes for hybrid learning back into the schools. Our kids have been out of the classroom for far too long, and in many cases haven't met their teachers or truly haven't had a chance to go into their schools. Some are new for the first time, whether they're kindergarten, first grade, or third grade and beyond. Our children have demonstrated resilience and patience throughout this, but not without struggles, both developmentally and academically. I do recognize all children are different, and some are struggling like mine truly are, and some are really thriving. And so what I'm really asking for is for the administration and the board to give us a choice. We recognize that for some families, hybrid is the right thing to do, and for other families, remote learning continues to be the right thing for them to do for the families. I think I speak on behalf of many of our parents, some who are here, that I request that you give us a choice to allow our kids back to the classroom. I think it's the right thing to do for both our staff and our administration. And after the last 10 months, we've learned a lot, and I believe that our administration has a plan that we can do this safely. So in closing, I just ask that you vote yes to get our kids back in the classroom.
Thank you.
Thank you.
That's all we have, Kevin, in the room.
Kevin, you're on mute.
Do we have anybody else
Thank
in
you.
the room just to speak? Oh, okay.
Hello, my name is Katarzyna Smolska-Dubois. I'm a mom of two Washington students, first grader and kindergarten student. My little girl didn't even make one step in her new school yet, unfortunately. So I am here also to hope that you guys will start hybrid as soon as possible. Because as a parent, as a community member, as a teacher myself, I think we are failing our children. The fact that gyms are open, malls are open, that you can go remodel your house and order everything in Home Depot doesn't make people upset, but the fact that the kids weren't at school for almost a year, it's okay. Every single program for Park District is closed for children, but open for grown-ups. So basically, if you don't have small children, you probably feel, oh my goodness, let's be safe here. But the scientific research, I even spent at least 10 hours researching it for myself because I am in-person teacher, shows that if the numbers are under control, children don't really contribute, and open school don't really contribute to community spread out of coronavirus. I've been working as a teacher with 18 students in my classroom since last June. I was scared to return to work after lockdown. My husband had 2 surgeries. He was very sick for over 8 months. And I didn't know what to expect. It was awkward to speak with my coworkers at first, how we even do this, coffee machine, things like that. But honestly, after 2-3 weeks, we adjusted to new protocols, new guidelines, sanitizing, temperature checks, disinfecting. And you know what's the funny part is? We adjusted longer than our students. Because if you're a child who didn't go to school for 10 months, you wanna be there. Tell my son is in a learning hub right now. He is there wearing mask every 6-7 hours in a playground, in a gym, during classes. He sits 6 feet away, and if he misses it, he is miserable because he wants to be with people. We all are. We all need socialization. We all need this kind of work. I sent to every member of the school board and few other people my email. I hope you received that yesterday night. And if that helps anyone, I would be happy to share experience in my school, which has 120 students in one location, in 4 locations, about 850 students. We private school. We had no outbreaks. We had people sick, don't be foolish. Someone gets sick. Sooner or later, we live in a global pandemic. But if you follow the rules, the protocol, if you do the right thing, it doesn't mean a disaster. My assistant 3 weeks ago was positively tested with COVID. I was with her every day, 7 hours in a room. Guess what? I got no symptoms, negative test. I never got sick. It can be safely done. None of my students or their family member got sick either. You can do it if you make efforts, if parents and teachers make efforts. And it's not so scary. It's scary at the beginning when you sit at home and you're scared to go out. But if you do it, you can really make safe environment for our students and for our children. And they will really follow the directions because they want to be back at school. Another thing I was hoping is that, and this doesn't need to be proven because all schools around us are open. So many, some of them like Palatine or Crystal Lake, 5 days a week. Some of them 4 days a week. Like Algonquin, for example. Some of them for hybrid. I hear that the Fremont district opens for 2 days hybrid starting February 1st, but for full day. As a parent who has to go to work and doesn't have a luxury to stay and work from home, I would really hope that you guys at least consider opening for full days. I understand that lunch might be a little problem, but it's solvable if you prepackage your food and serve it a certain way. The same with recess. The Learning Hub successfully spreads out kids for different recess times. My kids from kindergarten and 2nd grade never see each other on a recess, and they play and they enjoy each other. It can be done. For working parents, it will be huge relief because many of the parents cannot really sign their child for hybrid even if they wish for it, because they cannot pick them up at 11:30. They cannot leave work and say, okay, I'm taking my child home now. It doesn't work that way. So for us, working parents, for other people in the same situation, please consider it. We don't take away from parents who don't wish to the e-learning option. And we will support this forever. But it's just really important for students to have this break, to have this run out time in a backyard, in a playground, in a gym, to have more than 2.5 hours at school, because they've been 5 hours up to 6 hours on Zoom every single day during the week. And they have a lot of issues. I'm really concerned not just about my kids, because I try to provide all the kind of activities for them, but for all of them. Anxiety, screen addiction, all of the stuff. I don't have to, you guys familiar with all that. I don't want to waste your time for it. for 6 and 8 years old, like my kids, computer, it's not a tool to be educated with at this point. Forever. I mean, it can go for a month, for 2 months, but
Jessica,
not
we're
forever.
gonna have to have you wrap it up. We have others
Okay,
who wanna
that's
speak.
pretty much about it. I mean, if there are any problems or any issues, as a parent and as a teacher with 15 years experience, I love to help. So if there is anything, just reach out to me.
Thank you. Is there anyone else in the room who wishes to speak? Kevin, can you ask for online speakers, please?
Yes, anyone that wants to speak online, please click on the raise hand button on the bottom of your screen.
Could you please?
Hello, this is Deborah Barnes. I'm speaking. Can you hear me?
Yes, we can.
Great. Thank you, Mr. Holly and the board for giving me some time to speak. I just wanted to talk about some benefits of the hybrid. I'm sorry, no. Some benefits of what I've seen with remote learning. Because I think, there's a lot of people talking about what isn't working, and I want to point out what I feel is working. So a few benefits are, I feel as a parent more connected to what my daughter is doing every day, because I'm able to see what she's posting and what she's doing in Seesaw. And then I get to hear her teacher's comment on every assignment she turns in. So I'm feeling more connected as a parent. I'm able to participate more as a parent in that I've tried to, for the past few weeks since Christmas break, record myself on Seesaw reading a book to the students. So then I could do like a read with me. So I picked some of my favorite books, so I'm able to participate that way. I can build a relationship with the teachers, not being a room mother, or room parent, because I wouldn't be able to do that without without remote going on. And for my daughter, I believe that there's a lot of new skills she's picked up, technology skills, learning how to navigate through Zoom, learning how to navigate a computer, really important life skill of problem solving and working in technology, which is basically the way the world is moving in the future. So those are some positives. I did want to also point out that I feel as a parent who is going to keep my child remote, that, I voiced this to the principal, that we as all parents, I feel, need a go, no-go date. So, we need the school board or the superintendent to give us a date. If we're not in session by X date, then we're just going to stay remote. If we're constantly in the state of flux, it's very hard for a lot of parents, because we don't know when the schedule is going to change. I mean, even being a remote only student, my daughter's going to be expected to sit for 6 hours in front of a computer by herself without any interaction with any teacher. I mean, I know as an adult, if you want me to sit in front of a computer for 3 hours without any interaction with anybody, and just doing work, that would be hard. I mean, I don't do that as a professional, sit 3 hours. What this also does is it cuts down the interaction time for the students with the teacher, because they don't have that teacher for 3 hours. They don't have other students for 3 hours. Twice a week. So you're now taking away that social aspect for the remote kids. And then thirdly, the remote schedule that's proposed, I am definitely not a fan of, because it's too much change for these kids. You're now having them go remote or in person one day, and then fully remote, then in person one day, then fully remote. So you're causing 4 changes in a week. it would be better if we could do a back-to-back. So Monday, Tuesday, they remote, Thursday, Friday, they remote. That's 2 changes. It's, this half of the week, it's actually 1 change, sorry. This half of the week, you're remote, this half of the week, you're in person. So then everybody's not having to figure out what they're doing on what day. I find that can cause a lot of anxiety to kids and parents, because they're having to really keep track of not only what their kids are doing every day, but now, are they in school? Are they out of school? And I find it hard that, there's still a lot of remote need right now, due to the fact that our numbers are still very high. And I believe that, the majority of people want to do the right thing to be able to go hybrid, but there will be people that will be sending their kids sick. And we all know that, because they don't want to, can't be home with their kids, or, they don't think they're that sick. They're not taking the temperature, even though they're signing the waivers that they are. So we just need to be aware that not everybody's going to do the right thing. And that's what I have to say. Thank
Okay, thank you, Deb.
you. Mhm.
Who's next to speak?
We're working on it.
Hello, can you hear me?
Yes, we can.
Excellent. Hi, my name is Ken. I have 2 students in District 75, and I wanted to speak out saying that I really don't think that hybrid is the right thing to do at this time. For the first reason, the Lake County Health Department still says that we should have an incidence rate below 14 per 100,000 residents, and we are at almost 27. So we are at nearly double the incident rate that Lake County says is safe. We are also at 8.8% positivity, which is also above what Lake County says is even reasonably safe. So as of right now, we are at what Lake County says is highest risk indicated for incidents per 100,000. And as far as I know, the 14 per 100,000 has been the benchmark for District 75 since at least November. And that was part of the reason that in December, we did not go hybrid, even though we wanted to. So the last time we were below 14 per 100,000 was in October. So if it wasn't okay to go hybrid in October, I'm not sure why it's okay to go hybrid now. So I'm really not sure why that's okay. Secondarily, the kids who are at home, everybody's doing remote learning. Everybody's doing it synchronously. And I think I remember in the spring that a lot of people had a lot of trouble with the asynchronous learning that happened, where kids were essentially doing homework all day. They had maybe an hour of check-in with their students per day, or excuse me, with their teachers, and it didn't really work very well. And so now, instead of all students having synchronous learning as they are now, the remote kids are going to have 6 hours a week of asynchronous learning, while the in-person kids are going to have synchronous learning the entire time. And so I don't really see that as fair. In addition, the kids who are going back for hybrid learning are going to be riding a bus every day, which means that they are going to be exposed to a whole bunch of kids who are not in their classroom every day. And as we know, the concept of pods, meaning that students are exposed to only a set number of other students plus their teacher, so that if anybody gets infected and spreads it to the rest of the people, it is limited to that small number of people. However, if you have a whole bunch of kids riding the bus with kids who are not going to be in their class for those couple hours a day, then all of those kids, could be infected in the bus and in school. And so I guess my main consideration is that it feels like this may be pressure coming from the community saying, it's been too long and we just want to open regardless of whether the metrics say that it's okay to open or not. And I don't know why we would want to discount what the Lake County Health Department says is, at literally highest risk category, and why we would say, well, that was highest risk in October, but it's not highest risk now. So that's what I've got to say.
Okay, thank you very much.
my name's Nicole Russo Ponceron, and I'm a parent of a first grader at Washington School. I have a couple of main points. First, in talking with a lot of different teachers, it doesn't sound like there's very much communication with them about what the plan is and how all the transitions are going to happen. So I'd like to know more about how you're collaborating with the teachers to do the change in the schedule for both remote learners and hybrid learners. I also have concerns about how the TWE kids are going to be affected, as the schedule that's proposed really doesn't take into account that the mornings right now are all in one language and afternoons are with another language. So the way the schedule is set up, I don't see how that's feasible for TWE kids. I also think that the schedule changing so frequently is going to be a nightmare for the kids to keep up with. I'm also concerned that teachers may be asked to monitor both kids online and in person, and that's not tenable for anybody. So I think all of the kids would be suffering. So I just think a better plan needs to be in place. And finally, I think that the other schools that have done this successfully have had plans where they had breaks from the hybrid when the flu season was high and when the rates are up. So many of the schools are going back, after February or in the spring when they can be outside again. So I too am concerned that this is a time to go back when you're going to just be seeing rises from people who traveled over the holidays, and how that's going to be accounted for. Thank you.
Thank you.
My name is Michelle Grady, and I am a parent in the district, and I also am a teacher at a public school in Lake County, and I have been teaching in person as well since September. I teach at a preschool through 8th grade district, so we have a large range of students that come into the building every day. And they are there 5 days a week for full days. The families that chose to keep their kids home for remote learning has allowed us to be able to do the social distancing 6 feet apart and follow all of the guidelines that the state has given us to follow. So I would just like to say that first. So having kids and parents choose to have their kids remote has helped us do that. I just wanted to also reiterate, we have not had any transmission of the virus in school. We have found that overall the experience has been truly amazing, and the kids are definitely more engaged, and the teachers are able to make connections when they're there with them. There was an adjustment period, but it gets better every day. And we do have teachers who are teaching kids in person and on Zoom at the same time. It's exhausting. It's not like any teacher probably ever imagined, but we're making it work. And like I said, we just kind of keep on going, and we learn new things every day. The kids are resilient, and they do adapt easier than we think. And we need to give the kids some credit here, because as I said, and as the woman who spoke earlier, the adults are the ones who have the hardest time, I think, with all of the changes. I think as teachers, we've been going through a mourning period of what was supposed to be a normal school year, and parents have done that as well. We're all mourning the loss of a regular school year, but here we are, and it's January, and we know what we need to do. We know what the guidelines are. The Lake County Health Department has left it up to the local school districts to figure out how to mitigate and get the kids in safely. They've taken the metrics kind of off of the website to allow school districts to make the decisions. And I think that if we have a solid plan and we have the PPE and we have everything set up, we can be successful. The bus is not an issue as long as everybody is spaced. And if you have enough parents who are driving, then that alleviates that concern as well. And just overall, I think change is hard, but I think that if we don't give it a try, we're never going to. I think that the hardest part is just getting everybody in the buildings. Once we get there, everything will improve and everybody can make changes where they see changes need to be made. And we need to do this for the kids, for the parents, for the staff, everybody, just to get everybody kind of back into the mindset of what we're doing every day for the kids. Thank you.
Thank you, Michelle. Next up is Sarah.
Hi, yes, my name is Sarah Heuser. I have a first grader at Washington, and I would just like to please ask you to really consider getting our kids back in school. And I just want to remind some of the other parents that we are given a choice. And if we choose that we are comfortable enough and the school can provide a plan that makes sense, I think we deserve that. And I just ask you guys to please consider sending our kids back to school. My daughter, who went to kindergarten last year, loved school. And now all I hear is that she hates school and she is just miserable most days. And it breaks my heart as a parent to watch this. And, it's really stressful. And I get that there's a lot of decisions that need to go into this for you guys. But I just beg of you to consider doing what's right for our kids and for the families that are comfortable with sending their kids back to let them go and get their faces off of a screen all day long. It's so hard to watch. And I just want to see my daughter happy again and in school. She just came into the room right now and she's nodding her head. Can you tell them that you want to go back to school?
Mm-hmm.
Can you say that?
Yeah.
Say it so they can hear you.
I want to go back to school.
Yeah. Thank you for your time, and I look forward to seeing what you guys decide. Thank you.
Thank you, Sarah. Next up is Mrs. Sweet.
Hello.
Hello, go ahead.
Hi. My name is Carrie Sweet, and I have a 5th grader and I have an 8th grader. And I did choose to keep my kids remote. They have been doing a fabulous job. The teachers are fabulous. My kids have learned so many new things as far as all the things that Mrs. Barnes had said. They've had a very good experience. And even my son, who was not as organized before, he's become organized. He knows the schedule. He keeps everybody else in the house on top of what their schedule is supposed to be. They have learned so much life skill just through this. And they've been very positive about it because they know it's not forever. It's going to be just a blip in their life. Like Mr. Pilot had said, it's kind of like a passing period. This passing period lasts a little bit longer than we all wanted, but that's okay. And they know it's not for the rest of their life. Some of my concerns, though, for starting a hybrid is that the schedule that looks like I'm worried that the remote kids, the kids who are going to stay remote, are going to suffer. They're the ones who are going to be making the sacrifice. I'm also a teacher, and my district is going back. They're doing 5 days just because that's what they can do, but they're treating it almost like 2 school years. So the first part of the year and the second part of the year, and some kids have had to switch classes, and some K-5 teachers are only remote and some are only in person, and their schedules fit the in-person or the remote schedule, so that those kids that had chose remote, they stay on their schedule all year and are not influenced or changed when the in-person go in-person or they need to come out and back and forth. It's seamless to them. There's no change in their day at all when they're remote. So I'm worried because there seems to be a lot of change for my remote kids, and it's just not going to be, it's not as healthy. And right now they've been doing so great and everything's been rolling. But if they're trying to figure out what they're doing 2 days a week and it's so different, that's kind of a problem for me. And I see it as a problem for them also. It's probably not the best solution. So it seems like a lot of change just to do 2 mornings in a week. It's a lot of change for every student in the district when it really is only affecting a small number that are going in person. And those that are choosing in person, that's fine for them. But now it's affecting everybody in the district, and that's really not okay in my mind. And I think that a lot of parents are thinking that going in person looks a certain way, and it doesn't. It's very, very different. Kids have to stay far apart. They're not really socializing with their friends. They're not hanging out with their friends. They can't do small group work because you can't be within 6 feet of each other. So I just want maybe to consider a different type of schedule, something that's not really affecting the remote learners as much as the proposed schedule is. Those kids really don't need to be disrupted as much as it looks like they will be. And they're choosing remote for a lot of reasons. And one of them is that it's been going really well. So that's just one of the things I would like you to consider, maybe a different kind of a plan. I mean, I would be fine with my elementary kids switching classes to have a different teacher, even though I love their teacher, just so that their schedule's not disrupted as much. All right, I guess that's
Okay.
all I have. Yes,
Thank you, Carrie.
Mhm.
Next person up is Christy.
Hello, my name is Christy. I have 2 kids that go to Carl Sandburg. And I just wanted to make a couple of statements. And the first one is a question that I'm wondering if maybe the board would be able to answer before this meeting is over, that I tried to call up to the schools, and it's very unclear as to why so many other school districts can be open under the metrics, yet Mundelein has never been opened. And it seems like no one has answers to this. So I just am wondering if at some point someone could please answer that question. After that being said, though, I am definitely in favor of the kids going back to school. One, just as a personal anecdote, I'm a single mom. I struggle right now with trying to be home to supervise what's going on in my house. My kids are in 6th and 8th grade, so they're old enough to stay by themselves, luckily. But the reality of the situation is that all the kids are on their Xbox the whole entire time. And it's not just my child, because all of the other children are on the Xbox too, talking. And this is just one little pod. So you know it's happening in so many other circumstances. My other child has developed severe anxiety. He's gained about 20 pounds just not being active. He has so many irrational fears at this point. And I just don't think that everyone is really looking at what this is doing to our kids in their head with anxiety issues. I'm a yoga teacher for my own profession, which I've been teaching in a studio in person with masks 6 feet apart. And if you can go to yoga, I just think it's ridiculous that our kids can't go to school. I mean, everywhere else is open. You go into Target, you're around people all the time. You go into Home Depot, you go to all these places, you can go to a mall, yet the kids are not in school. And I think that the teachers need to have some accountability at this point, because a lot of us just have to go back to work. That's just the reality of the world. And another thing is that I don't think that people are really looking at the reality of the world here. There's no guarantee that vaccinations are going to work. There's no guarantee. If you look at every pandemic in history, it ends the same way. And so at what point are you willing to say enough's enough? This started at 2 weeks, then it went to 3 months. Then now we're going on 10 months. I mean, it's time to just really think about what's going on. The other thing is there's an option. So all these parents who are saying that they don't want to go back, that's fine. But for the other ones who are really suffering, mentally suffering, that could irreversible damage going on, I think you need to really consider that. And if for some reason you're not going to choose that, I strongly urge for you to set up some type of social clubs so that kids can have some type of interaction, that they can go out and do exercise into this world, because there's a lot being missed. All right. Thank you very much.
Gentlemen, do we have any more online?
Kevin, you're on.
Hi there. My name's Jim. I think I was just invited to speak. Kevin, you were on mute. Sorry, I didn't hear you. But thanks for letting me talk. My name is Jim. I have a kindergartner in the district. And I think like every parent, I would love to have my child in person, but I'm opposed to especially this iteration of the hybrid learning plan. I think my biggest question and what I'd like to hear addressed is that I don't understand who is going to benefit from this plan, because it seems that in exchange for a few meager hours of in-person learning for a small or some group of students that choose to go in person, that not only are we going to be endangering the hundreds or thousands of students and teachers and staff that have to go back to school, especially right before educators are eligible to receive the vaccine and when they could potentially in a few weeks or months time be able to go back in person safely, that it's just going to be more difficult and strenuous for everyone. I think it's going to be hard for teachers because they're going to have to plan different kinds of lessons for different groups of students for those hybrid days, which is going to be an extra stress for them. And it's going to be a logistical challenge for parents that are going to have to either arrange for transport or supervision or bus drop off or pickup for all their students doing their in-person learning. And it's going to be a logistically challenged for parents of virtual students, because with my daughter at home, and if she has to do 3 hours of unsupervised learning, she's not going to be able to do that independently. Whereas when she's in person and with her teacher, she can do that mostly independently, and I don't need to be with her the whole time. But it's nearly impossible to keep a younger kid focused on independent work for an entire morning. And the in-person students are going to have to do the same thing in the afternoons of those virtual days. So it's going to be a real challenge for all of them. And then, I see the benefit of bringing students back in person and would love to be able to do that. And it's great for the students that do choose hybrid, but if you choose to keep your child virtual, you get a worse education for that student in exchange for trying to keep them safe. And there's no benefit for these students. They have a harder time learning. They get less time with their teacher, and they get nothing out of it because we're keeping them home and where it's safe. So I'd like to see either a justification for who's going to benefit or what the rationale for this kind of learning plan is, or an adjustment to the plan that makes more sense, that gives students an equitable education. So thank you very much for your time, and that's all I had to say.
Thank you, Jim. The next person on the list is Kelly. Kelly, are you there? One more time for Kelly. Kelly, would you like to address the board? Okay, let's move to the next name on the list, which is Laura.
Hello, my name is Laura Hurley. I have a kindergartner and a first grader at Washington. My kindergartner was previously at Lincoln last year. And first, I want to say thank you to everyone for the time to speak and all of our teachers and staff for the work they're doing. But I do believe hybrid, at least for my kids, is the best option. I actually ran into one of the teachers during supply pickup, and she was excited that we chose the hybrid option, even though we are a family that does have a medically complex individual, and we are preparing to say goodbye to that person. So with that said, we do believe hybrid's the best option for our kids. One of my children does get occupational and speech therapy, and he does complain that receiving his therapy services over the internet really stinks. I know we probably will not get those services during hybrid learning at school, but even seeing his friends there, even with masks, will be completely beneficial. They do actually go to a local martial arts place in town for e-learning. And previously, before November, they did not wear masks there for the kids because she knew kids struggled, but they've only closed once since then and now have masks for everyone and have not had any outbreaks. So it is possible to be safe and keep everything at a standstill. That's basically all I have to say. Thank you.
Thank you, Laura. The next person on the list to speak is Kristen.
Hi, yes, thank you for taking the time to let us all speak. I appreciate that. I have two children that are in first grade, and I realize a lot of parents, the remote learning works really well for them, and that's a choice that they get to make. But I feel that it's unfair that all of us have to pick one thing. We need to do what's best for our children, what we believe is best for our children, and I believe that we should have the opportunity to choose what's best for our children. Excuse me. So I would like our kids to be back in school. That works for my family. I realize it doesn't work for all families, and they should have that opportunity to keep their kids remote if that works for their family. But for those of us who want our kids back in school, I think they should be back in school 5 days a week, like many of the surrounding areas have done. There has been no issues in other schools, and I believe that everybody has the right to make this decision personally for their family. But I want to make this decision for my kids. I don't want somebody else making it for me. So I would like to see our kids going back to school 5 days a week. And if there is an issue, we cross that bridge when we get to it, but we can't just sit at home waiting for something to happen. I think our kids need to be back in school. If you want to keep your kids home, that's great. You should have the opportunity to do that, but I would like my kids to go back. Thank you so much for your time.
Thank you, Kristen. And next on the list to speak is Sarah Christ. Sarah Christ, please go ahead and address the board. Sarah, one last chance. Would you like to address the board, please? Okay, I understand that there is another person that is in the boardroom that would like to address the board. Please go ahead. Please state your name.
Hello, thank you for this opportunity. My name is Allegra Milner, and I have two kids in District D75. One's at Washington, first grade, and one's in third grade at Mechanicsville. And I just want to say I truly am requesting the board to give me and my family the opportunity to select. We would select to go in person. We've selected since the first time you asked us in our survey that was presented, and we keep saying, yes, please. I hate to be an expert on the topic. My dad's a psychiatrist. I have a master's degree in counseling. I'm the director of student counseling at a professional healthcare related degree. My students have been back in the universities, and I've been counseling them through this pandemic since June. I don't understand why our students can't come for 2 hours a day when they're suffering from anxiety, depression. My son too was assigned an occupational and a speech therapist when he was in kindergarten, which we unengaged when we went remote in March. And I appreciate the services and the reaching out we want to continue this year. We'll do that at home. I'm teaching them at home. We're doing it at home. I too go to the same martial arts amazing e-learning academy because I am a working parent. I can't e-learn at home. We do half days. They go half days there. There's been no outbreaks. We've closed once for a week. Everyone was fine with it. My children need it. We're asking for it. And it's been an option that's been presented to us. So I respectfully accept the option to send my kids back to school 2 days a week for a couple hours. Thank you.
Thank you. Okay, one last chance if anyone would like to address the board. Okay, hearing and seeing no one raising their hands online, we are going to move on. Typically, the board does not address comments. We're just here to listen to what people have to say. But the one thing that I will say is that tonight we're going to have a presentation about the hybrid plan. And hopefully that answers a lot of the questions and the different topics that parents and friends brought up today. So we will move on to that with our first District 75 report, teaching and learning.
Good evening, everyone. It's certainly been a long journey. We started this back in August, talking about what to be able to do and looking at planning for a school district. I think what's taken place during that time has been a lot of collaboration amongst the leaderships of the union, administration, and board, at times all being in the same meetings together, planning different paths for us to be able to bring students back into our buildings. I think along that way, we've learned a lot. If we remember, I think we did take a conservative, prudent way, like most districts did, and we selected to not have students in session back in August when the numbers were at their lowest. And since then, we've learned a lot more, because now I think many districts, you look back in hindsight, you say, yeah, we probably should have been back in August. But I think that's because we're learning as we go along in this whole process. What has been the best part about it is we've continued to keep the conversation going and looking at the options for how we can bring our students and staff back in the building again. That's why we are here tonight, to be able to bring that recommendation to you to say we would want to start on February 1st, a hybrid model for bringing our students back in for the parents that are making that selection. Questions come up about why are we now going away from the metrics? And I'd say we're not going away from the metrics. The Lake County Health Department back in December recognized it wasn't their place to designate a learning model for the entire educational system in the county based off county numbers that did not relate to the student populations we were serving, meaning the ages. So what they did is look at how they were calibrating their numbers, keeping them same, but they're redesignating them. So they are going to be rated as highest risk, high risk, which does connect to the CDC. Now, the other thing that's happened is Lake County also recognized, and this question's asked because the superintendents of Lake County meet every week, and we've been doing this since May with the health department. They acknowledge those numbers of highest risk equate to not being able to guarantee any mitigation measures have been implemented because they have no control over that. Main ones being wearing a mask, social distance, wash your hands, cleaning and sanitizing are some of the key factors. So they've acknowledged that. And in those conversations, they've said, take that into consideration for your organizations as you start the process of determining whether or not you can bring students back into the building in an environment that would be conducive to make that happen. So when you do that and you look at the plan we have, I'd say our plan tonight is a good plan. It's a good starting point for us because I think what we all know, is it going to be the exact place we are at the end of the year? If anything tells us from our past, the answer is no. It's going to develop. It's going to continue to grow as we go along as a district. I think it's a prudent starting point for us to begin our instruction of getting our students back in so we can acclimate. It also follows what our surrounding school districts are doing. And I think when you look at that, as of the beginning of January, just the elementary districts alone in Lake County, total of 28. We have 19 of them starting in a hybrid before the end of January, with a number of them also beginning no later than the 8th of February. That means we have 7 of those districts still in a remote and 2 that I did not have the information for because this is dependent upon the information we get from the superintendents. The second part when we look at it is also the unit districts. They have elementary districts. Wanting to make sure to see what they're doing. What we know is we have 5 unit districts, which is a pre-K through 12. In those, 3 of them are going back into hybrid if they have not started already. So just crunching all those numbers real quickly, that means by no later than February 8th, 63.6% of the school districts that we have the information for are going to be in a hybrid model. So when you ask yourself, why is that for us and looking around, one of the things that we did a couple of months ago, we went back and looked at data because we're not throwing out the data. We do want to know what the metrics are. We want to know what our local metrics are in our own community, which we've done. And if you look at where we are for our zip code, our numbers are trending down. They have been trending down. In fact, Mundelang's numbers are better than a lot of other districts around us that are already back in session. But remember where we started. 2 months ago, said, look at state numbers. So when you look at the state numbers, the incident rate that's taking place just in Lake County, and here's what I'm referencing with our local metric data. Our local data from January 8th to the 14th for incident rate per 100,000 went from 39 down to 26. Lake County right now on January 14th is at 30. So we are trending better. That's a good trend line to look at. The next thing I go and look for is state. At the state level, you look at the concerns, outbreak. Remember that presentation, outbreak means 5 instances that occur within a 14-day period within that institution organization. At the state level, they did not have any data that related to, when you go to the Illinois Department of Health website, that showed significantly the percentage of schools, whether it's public or private, that there was that significant of an outbreak. All of them have been 4 or less. When you look at Lake County, there were 4 overall for outbreaks, 0 in Lake County. Let me rephrase that. The outbreaks in the state, there were 4, for Lake County was 0. My first statement was, so the overall percentage of where the contact's coming from, it's not our schools. The second part is you look at potential exposures. It does not mean that happened at the school. It means that somebody may have caught it outside and came into the school just saying they could have caught it. Now, within the last 30 days, just for schools only, public and private, in the state, there was 378 potential exposures. In Lake County and McHenry County, because our region is combined with McHenry County now, there was a total of 19. So I think when we take those into consideration, see what other districts are doing in our area. So we know there are school districts, and they've been unit districts, there's 7 of them that have been in session since August, trying to get their data. Every one of them has been in session, and they've done selective adaptive pauses, mainly around November, when we thought there was going to be a jump in the numbers. That's important for us to hear because our schools have not been in session. So we're trying to look at data that, from other districts that have been in and have implemented these mitigations and be able for us to determine, can we do that the same way or better? And the answer is yes, we can. So what I'm coming to you tonight and what you'll hear tonight is a plan for us to start with hybrid instruction for our students. We'll keep moving forward with that plan. And one thing I can tell you, in order for this to be successful, is all of us have got to be in on it together. Our parents have got to make sure their children are feeling well and being able to send them to school. If there's any concerns, we keep them home. Same for us as adults. I can't ignore if I have a sore throat. I need to be smart and keep myself out of the fray until I feel better or know I'm clear. That's what it's going to take for us to be successful. That's the best advice I've gotten from any superintendent I've talked about on what to do to make this successful. So tonight, we're coming to you to be able to ask that the board approve the hybrid plan, and we'll keep bringing you back for updates for how we're doing. But recommend that we do have a start date for our students to come back on February 1st. And to go through the particulars of the plan, Dan's going to start off with the group. Thank you.
Next slide, please. So with me tonight, I have some of our central office members who are going to talk about some of the portions of our plan. So I'm going to start off, I'm the assistant superintendent of teaching and learning. I'm going to start off with the metrics and mitigation, reiterate some of the points that Dr. Myers made. I'm going to ask Jamie DiCarlo, our other assistant superintendent, and our chief of personnel, did I get that right? Staff, chief of staff, sorry. Shane McCurry to talk about screening, testing, and tracking. I have Mr. Dave Zaremba here to talk about our enhanced cleaning sanitation procedures. We'll talk a little bit about where we are in terms of our students and instructional choice. And in that time, we'll also talk and hopefully address some of the questions that we heard during public comment about the schedules. And then we'll finish off with some employee staffing, accommodations, and leaves so you get an idea of where we are in terms of staffing. And then at the end, we'll have Dr. Myers back up here and taking questions from the board. So with that, I'm going to ask to go to the next slide, please. So I'm going to start by sharing some of the metrics and mitigations that we've giving you an overview of how this is going to look. I want to share this is the backbone of everything that we're going to be doing over the next couple of months. And just like Dr. Myers has said, we're all in this together. We all have to make sure that we are all taking those mitigations to make sure that we're successful. This is our guide to reopening. Next slide, please. So Dr. Myers had mentioned that Lake County had changed their model for how they interpret some of the data. It used to be a model where they dictated some sort of model of instruction. I think it was last week, they moved to a more stratified risk model. What does that mean for us? Well, number one, it aligns with the CDC. CDC has been in this sort of model since August. And the second thing it is it takes into account the mitigations, which we're going to go through tonight. And those mitigations allow us to reduce the risk for our staff, for our students, so that we can provide an excellent learning environment for them. So the first part of our presentation is going to focus on those mitigations and to show how those mitigations can reduce the risk for our students, staff, and other members of the community so that we can hit our anticipated return date of February 1st. And so with that, I'm going to turn the presentation over to Ms. DiCarlo, our Assistant Superintendent of Student Services, to talk about some of those mitigations.
Thanks, Dan. So I'm here to talk about some of what we've been working on already with our staff, and our nurses have been incredible. I just want to give them a huge kudos throughout this process in educating staff, supporting families, and really getting us ready to go. So one of the things that we will be affirming with both students and staff is that we're always wearing masks, and that masks are worn at any point in the building, unless of course there's like maybe a spaced mask break. And typically those would be outside. So again, masks are worn at all times by adults and children. And then also as students, if their mask were to break, or if someone were to leave a location without their mask and need one, we do have masks available for both staff and students in all of our buildings. So we do have those on demand if we need them. So again, looking at our social distance practices in our buildings, we have posted signage, and we've been very successful in expediting these procedures in the hallways as staff have returned, and certain staff have been there regularly. And so we've been, again, working through that signage. In October, when we had our some of our students with IEPs in, we were utilizing the signage, and it was a really, really good cue for our students. And so we'll maintain that signage throughout the buildings. We limit the amount of adults in spaces and children in spaces. We have entrance and exit procedures for restrooms. We have every other restroom stall marked as open versus closed, so that we have that spacing within our restrooms as well. We also have stop signs outside of the restroom so that we can make sure that there's no more than 2 students at a time in the restroom. And again, teachers will be going through those procedures with their students as well. Our classrooms are set up with 6 feet between each desk. And then we're utilizing staff support as as students pass through the hallways. And again, those prompts and those that education that we're providing to the students. Washing hands, there are instructions in every restroom, and we kind of joke about the sing happy birthday twice, but that's a really good cue for our little ones. And so working through what it means, what good hand washing is, and providing videos and support and education to our students, as well as ensuring that we have supplies to make all of this happen on hand. So we have 3 months reserves in terms of our soap, our hand sanitizer, and our other PPE as well. So I'm going to talk a little bit about the training, some of the training that we've had for staff. So as I mentioned earlier, our nurses have been instrumental in working and representing in our Lake County nursing group and giving information back and providing that for our extensive nursing staff, working with COVID protocols, educating ourselves on the IDPH decision tree, and consulting with our pediatrician on the decision tree to ensure that we're following all of our protocols, our quarantine and other protocols in relationship to COVID. In addition, we have secured accessible COVID testing for our staff, and our staff is aware of how to get that COVID testing very immediately. So that's been extremely helpful as well. Our staff have completed mandatory health and safety trainings like they do every year, only this year those trainings include specific protocols related to COVID compliance, and then just general pathogens compliance, appropriate use of PPE, what social distancing looks like, and just extra precautions we need to have in place. So we have been able to complete that staff training, and our nurses have consistently been available to answer staff questions in these areas. So that's been really great.
Hello, everybody. I'm David Zaremba, Director of Facilities and Grounds for District 75. I'm here to talk about the ventilation systems in our classrooms and our buildings. Excuse me. All of the classrooms have been upgraded to the highest grade filter that we can put into univents that will allow. Bullet point 2 and bullet point 3 sort of joined together. The district has worked with our HVAC contractor. What we have done is we have got maximum airflow out of our units by opening our outside air dampers to bring more air in. What that does is allows the air in the room to be recirculated in 4 minutes. We are also working on the parts per million in the room to keep the circulation going. Standard on the univent is about 1,000 parts per minute. We got ours rotating every 400 parts per minute. So they're opening and closing all day long. CDC recommends 500 parts per minute. We brought it down to 400 because it's going to rise with a few students in there. This will also give that time to evacuate the air out and keep it in at that 400 range. Thank you.
I'm going to talk a little bit about our screening and our testing and our tracking procedures. First, we're real excited about our blue card certification process, and I've brought some of these blue cards to show you as well. For a nice little so the blue card is something that we're going to be asking of our families each and every single day that your student comes to school. So for us, this is one of the most important pieces of our process and our partnership with our families. It's very imperative that every morning, as parents or guardians, that there is a check being done with each student that would be coming to school to ensure they have none of the existing COVID symptoms and that their temperature falls below 100.4. So we're in fact working too with families where if they don't have the means to have a thermometer, to help support that process as well. So it's just instrumental that each morning the student is verified to not have any of these symptoms. If the student has the symptoms, we ask that the family call in to the attendance hotline and express what those symptoms are, because that's helpful information for us from a contact tracing perspective. And then that quarantine process, if they are COVID symptoms, would go into play, and our nursing staff would be happy to support you through that process if you have questions. But it is imperative that students with those symptoms do not come to school. It's also imperative that this blue card certification process happens daily. So it's not really just a symbolic blue card that would hang on the backpack. Each family for each student will receive at materials pickup next week. Each family that chose hybrid, that is, would receive a blue card for that student along with a lanyard. And every morning that you have your child take that to school, that signifies that your child has been clear of all these symptoms. So again, working with our families, students will wear those upon entry to the bus. That's essentially starting school, right? That's your connection to school. Or if your parent drives you or you're a walker, when you enter school, that blue card, you will be prompted for that blue card. And it is the expectation before entering that you have that blue card. So again, working through that process with families, more information to families will be shared in the coming week. But again, these blue cards will be available at material pickup next week for families that have chose hybrid. And then also families will be provided an electronic message to sign off that they're committed to this process as well. So that is our step with the blue cards. And then this is extremely exciting, our relationship with Pediatrust. So we have forged a partnership with Pediatrust, which is a very large, one of the largest pediatric organizations here in Illinois. And we are able to meet with them regularly each week. We have a weekly admin meeting and a separate day each week meeting with Dr. Friedman from Pediatrust with our nurses. So it's been invaluable. It's been amazing the support he's been able to provide. As an example, last week he was able to tour each and every one of our schools, looking at our nursing areas, looking at our hallways, looking at our entrance and exit protocol, and giving us feedback. He's looked at our equipment, our workspaces, our PPE, and again, giving us feedback. We're following a lot, of course, we're following guidance from IDPH and the CDC and what we receive also from the Lake County Health Department. But again, checks and balances, working that through with Dr. Friedman has been absolutely a huge support. Additionally, we have point of care, we have the opportunity for our students to test, our staff to test for COVID. We have a direct line, so we initiated that a little over a week ago now, or around a week ago, where staff may just follow a Google link and that easily sign up to get a COVID test. And within a half day's time, usually less, within the hour, someone from the Pediatrust office is contacting the staff member back and getting them scheduled same day or the next morning for that COVID test. And then that is, again, for ease for our staff as well. We're exploring additional pre-screening options for our staff and certain student subgroups. And our Pediatrust, Dr. Friedman from Pediatrust is participating in our town hall meeting. So we had our staff town hall this afternoon, and we'll have our town hall meeting with our nurses and Pediatrust to review protocols with families tomorrow at 6:30 p.m. Sorry, shameless plug. And then the following night at 6:30 p.m. we'll have the same presentation in Spanish. And again, it's just been invaluable to have access to a doctor, and truly, like, the Pediatrust practice has been running every day during COVID. So they've had those experiences to see what works, what doesn't, what's comfortable, what isn't. So it's just been an incredibly, truly valuable resource for us.
Yeah, and a quick question. Will they also be able to provide relevant and pertinent medical information? There's so much out there and people are trying to sort through it. So will they be a source of what's a legitimate conclusion versus, a 10-person study, versus a 1,000,000-person study? I mean, there's so much information out there. Are they going to help bring to the table relevant information just to inform?
Yeah, I think that's been great already. That's a great question, and we've already experienced that with Dr. Friedman. So it's really great because he will reference some of those studies, like you're saying, Lisa, but he combines that with practical experience in his practice day in and day out right now. So as a senior doctor on his team, which expands to many doctors in many offices, he's able to say, this is what the studies say, this is how we're applying it practically right now. I failed to mention that our staff can email directly to myself or Shane or their building principal, any question. And again, he's so accessible, meeting with him twice a week, but being able to communicate with him more frequently than that if necessary to get our questions answered. Thanks.
So one thing that's going to be imperative to make a hybrid schedule work is how quickly can we identify students or staff that might have COVID, and then how quickly can we conduct contact tracing to determine who they may have come in contact with. So Jamie already mentioned that the relationship with Pediatrust gives us a conduit for quick and reliable testing. If a student or staff member that gets tested through Pediatrust, if they test positive, Pediatrust will notify the county on our behalf so that Lake County Health Department can start doing that contact tracing. They'll also notify us. And by keeping very diligent records of staff attendance and movement throughout the building, as well as student seating charts, we will be able to aid the Lake County Health Department to do very efficient contact tracing so that we can quickly determine who is safe to stay or return to the building, and who, out of prudence, needs to be part of a quarantine. One thing that we are going to continue to do, that this was mentioned at a previous board meeting, is although positive tests or someone that's symptomatic, that's going to be HIPAA protected information, we can share with the district employees and the public the raw information that we have. So the nurses are keeping track of any students who are reported as having COVID-like symptoms and need to be sent home. They're going to monitor and track students who report close contacts to someone that tests positive for COVID, and they're going to monitor and report positive COVID cases for students. On the staff side, Tina Rutledge and I are going to be responsible for maintaining that exact same information, and there will be a chart that's updated weekly on the D75 website that will show the prior week, the current week, and the total number, so that staff will be aware of what is going on in our buildings. If it's a situation where in consultation with the Lake County Health Department, the doctors from Pediatrust and district administration, that we feel it is prudent to enter into an adaptive pause, we will elect to do that. It's unlikely that we would need to go into a district-wide adaptive pause because we have different buildings. So you could see individual classes switch to asynchronous learning. You could see a program possibly put on pause as quarantines take place and contact tracing is conducted, or a individual building close in a worst case scenario. But we do not foresee a situation in which the entire district would face closure due to COVID exposure.
And I'm going to talk about our enhanced cleaning and disinfecting procedures. We have installed automatic toilets, urinals, faucets, soap dispensers, paper towel dispensers in all of the restrooms, staff and student. We social distance all of them, so the students will not be next to each other. We have them blocked off. We have manual drinking fountains have all been turned off, and we only have bottle fillers that will be working. All nurses' offices have been supplied with a Cavicide disinfectant wipe and spray, which has a dry time of 3 minutes. So there's a quick turnaround for students that have to go in. Bathrooms will be disinfected every 30 minutes. High-touch areas will be wiped down throughout the day. So as we're going from bathroom to bathroom, we'll be wiping all of our touch points at the same time. Each individual classroom has initially been supplied with disinfectant wipes, spray and sanitizers, cleaning rags, disposable gloves, masks, and face shields. As the teachers run low, they will let the offices know. We will resupply them and restock them. We have about a 3-month supply in my shop right now, and more coming. Next slide, please. All the rooms will be cleaned and sanitized by our cleaning crew with a salt solution, cleaner, and sanitizer first every night. Second step of this will be all rooms will be disinfected with a PureTab electrostatic machine, which is Clorox and water, and it comes out of an electrostatic machine. We are also using a UVC disinfectant light that kills 99.9% of all germs, of all airborne viruses, including Corona, SARS, influenza, and E. coli. That will happen every evening. The UVC disinfectant will happen every evening. If needed during the day, it only takes 15 minutes. We can rotate a classroom around so we don't have to keep the kids out as long in the rooms. On Wednesday, we will go through with our cleaning crew and we will do a head-to-toe cleaning on everything throughout the building, so the kids will be cleaned and sanitized for the next days of school. Thank you for your time.
So we've talked a lot about the mitigations that we allow us to come back to school. Their timeline of February 1st. Want to talk a little bit about the instructional choice data and then also give you a little glimpse of the schedule. So next slide, please. Board and community, you've seen some of this data before. We've been very responsive to when parents want to choose to change from hybrid to remote or remote to hybrid. We've stayed pretty steady, about 50-50 in terms of choosing hybrid versus remote. We've worked with our principals should be worked with their teams to make sure that anybody who hadn't turned in a survey or had no preference, we've gotten a hold of most of those students. Those students who have no preference have been moved into hybrid. This helps for our planning purposes. But again, as parents want to make decisions to choose to move into one or the other, we've been very responsive to that. We've been working with those families. We're asking that our families choose by January 24th. This gives us the time to get together the schedules, class lists, all those pieces for our teachers. And then we anticipate that at some point we'll have a survey, probably getting closer to spring break, to do large scale changes as we enter after spring break. That gives you an idea of where we're at. And we heard sort of that through our comments today. I want to take a moment to look at our schedules. I want you to understand the schedules that we choose, we try to give you a 30,000-foot view. There are so many schedules that our students have access to, our teachers use on a daily basis. We have special education intervention schedules. We have two-way immersion schedules. And so I'll try to talk to some of those as we go at our schedules. Your principal, your child's principal, will have a more detailed schedule. You will get more details on your schedule, and we'll make sure that you get that information that you need. So if you go to the next slide, we're going to kind of look at our K-5. You've seen something like this before, and I want to make sure that I address some of the questions that we saw in our heard from our comments. Number one, the on-demand time for our K-5 students. Our teachers were very clear about one thing. They did not want to have concurrent education in K-5. They thought that that was difficult. Concurrent instruction is when the teacher is teaching both the students at home, the homies, and the students and the roomies. So we wanted to make sure that we could create a schedule that allowed for that. And so that's what our principals and our teachers have done in this schedule. Our students in hybrid, when they come in the morning, their teacher is going to focus on those students and not worry about the students who have chosen remote. So what are those students in remote going to be doing? Yes, there are going to be some on-demand activities, but it will not be 3 hours of on-demand activities. We know that that's not developmentally appropriate for many of our students. So we've made sure that in this time, we've reorganized our schedules to make sure things like specials, interventions, other things like that are happening for those students at that time. So are they going to be without a teacher? There may be some opportunities, but not the whole time. And we want to make sure that that's very clear. In terms of two-way immersion, we're committed to making sure that students who are in person have access to both languages when they're in person. And for the students who are in remote, are going to have both languages in that. Will it be a morning Spanish and an afternoon English? No, it's not. But we've reworked our schedules to ensure that we have that commitment to you. I want to make sure I'm hitting all my K-5 stuff. Oh, and then finally, we know that this can be a little bit confusing on the schedule and that each individual student, based on what they're going to need, an intervention, an extension, whatever that is, our teachers during our remote planning days are going to be working with our principals to make individual schedules for those students. So every student who chooses hybrid, when you come to materials pickup on the 28th, and possibly before even emailed to you, we'll get that individualized schedule. So you'll know, what is that on-demand time going to look like? When are they going to be without a teacher? And when are they going to be with the teacher during that on-demand time? Okay, next slide, please. This is our middle school schedule. You know, when there are unique needs of a middle school, and in the middle school, Mr. Pilot, Mr. Sand, and his building leadership team looked at lots of different options. They felt that concurrent instruction, teaching the kids in remote and the kids in hybrid at the same time, was what they wanted to do. And they built a schedule around that. And so that's really what you see here. So students who choose hybrid are going to be in person based on the letter of their alphabet. And then will be the students at home will remote in. On Mondays, A through K, those students will come in. All the remote students and the students in hybrid L through Z will be at home logged into that computer. We've been working with our teachers since October on concurrent instructional strategies. And we'll continue to work with our teachers as we move forward. And we have actually a full day with Carl Sandburg teachers working as teams, practicing the stuff that they've been working on and preparing for our students to have concurrent instruction as well as our teachers. We're confident that we'll be able to provide the best instruction for them. I know that there were some questions about, well, why for only so short of time? And I know one of our teachers back in October had shared with us why it's so important to have our students come in. the amount of things that they can do in that small amount of time, it would take them 3 or 4 times that amount of time in a remote setting. This allows us to accelerate the learning for those students whose family deem that this is the most appropriate. Next slide, please. So with that, I'm going to turn it over to Shane again to talk about some of the staffing employee staffing accommodations and leaves. And then we'll go into questions and finish up with Dr. Murch.
So in order to make the hybrid work, remember when I said that we didn't anticipate going to shut down a building or the district because of a COVID outbreak? One thing that we are being very sensitive to is, are we going to have a sufficient number of staff to be able to provide this instruction, recognizing we may have staff that will have to take a leave of absence because they have been exposed to COVID, have COVID-like symptoms, or test positive for COVID. Then you layer that on top of staff who have elected to either take a leave under the Family Medical Leave Act because they have a family member at home who is medically fragile and they have sensitivity in bringing COVID possibly home, or you have staff who themselves have a medical condition that qualifies as a disability under the Americans with Disabilities Act and requires a reasonable accommodation. So when this slide was originally prepared, we had 4 staff that was district-wide that had applied for and were approved for Family Medical Leave Act. That number since Friday has gone up to 7. Of those 7, 4 of those are maternity or paternity leaves that have nothing to do with COVID. We anticipate getting some more requests regarding this leave, but right now that number is manageable. As it pertains to staff requesting an ADA accommodation, when the staff are making this accommodation, they're asking to work remotely. And right now that number is listed at 7. It has gone up by 1 since Friday. Again, we do anticipate other staff speaking to their medical providers to determine if that is something that is available to them. But we continue to work through that to make sure that the instruction won't be inhibited by where the staff would be physically teaching. One of the questions that came up is, are we prepared for the situation where we have staff that either are gone due to a leave or because they fall under the COVID protocol? And right now we have a pool of 13 substitutes that are fully trained and ready to go. They're familiar with all of our district policies and technologies, and they can step in at a moment's notice. Additionally, we are working with 5 other candidates who have expressed an interest to be a long-term sub. One of the benefits of possibly being a substitute, if we continue to have a shortage, is since those school personnel fall under category 1B for vaccinations, that would be a possible incentive for those who are listening, that if they might want to sub, that would put them on the list and make them eligible to receive a vaccination earlier than they might otherwise. Any questions?
So next slide. I know Shane talked a little bit about addressing our staff absences. So yes, we always need subs, and if that helps you get to be your sub license, come on down, because we've been providing some professional development for our subs on our safety protocols, on the technology that will be used, as well as on the instructional practices. And we've also set up computers with accounts so that they have access to anything District 75 when they're in the building, when they're working with our students, because that is what is most important, to make sure that that instruction does not have any gaps because we're having a staff out for one reason or another. Next slide, please. Touched on this a little bit. We're looking to have the board Also approves 2 remote planning days. We know that it's short notice, and hopefully many of our parents have read our email over the weekend so that you can start being proactive in preparation. Those days are really important to our teachers. It allows them to get additional professional development and have planning time so that they're ready with the safety protocols, the technology, instruction, and curriculum in order to support the students the moment they walk in the building. So we'll be doing that next Monday and Tuesday. And then I also want to just reiterate on the 28th, materials pickup for those in hybrid, individualized schedules for your students. The blue cards, I think, will be part of that. Yes. And you also get emails in addition to this, but also some of that material will be important for hybrid instruction. So I encourage you to make arrangements for that material pickup. That's one of our more important ones as we transition to this new instructional model. And so with that, I'm going to turn it back over to Dr. Myers for closing remarks and then taking some questions from the board.
So in closing, I think the one thing that we can agree on, there's not a one size fit all in this process that we're going through. I think just as we went through public comment, where you lie, hybrid or remote, it's always about 50-50, 60-40, 70-30, it's in that realm somewhere. Everybody's got a different opinion on it, and we need to do the best we can to give people choice. What I can assure you is that in talking and working with our staff and working with our leadership teams, which we do meet weekly with, is that our staff is committed to ensuring a safe and sound learning environment and meeting the needs of all of our students. They've said that. What I want to make sure we are assuring to everybody else is that we are also looking at the metrics. That's one of the phrases here, we're not using metrics anymore. No, we've been given the rights to be able to look at it differently and using the mitigations that we have in place. So we are going to be using the metrics as a guide for us. We're going to be applying those to the metrics, that mitigations that we've got in place that you heard tonight, and be able to do that in a way that provides us the opportunity to bring our staff and students back by February 1st. And I know we're committed to being able to do that, and we'll be able to make that happen. So with that, I'd like to ask if there's questions that you'd like us to go back to and answer for you.
Will Pediatrust be able to expedite vaccinations for our staff at all, or is that strictly under regional governmental control?
So Pediatrust is not directly involved that way, like just for us. What Lake County schools are doing during our weekly meetings with the health department, they are coordinating with the Lake County superintendents. We have pods, school pods that they're calling them. Right now, District 75 and 120, we are going to be connected to the pod of staff that will be going to Stevenson for the vaccinations for those staff that select to sign up and getting a vaccination.
So I think Dan addressed this question, but I want to make sure I understand it. So for those students who have chosen to remain remote, when the students are in hybrid and the activities that are in yellow, which are special subjects and those kinds of things, those students will get that, they'll be able to interact with staff?
Yes.
Correct? Okay.
Yes. It'll look a little different than a typical school year, right? Oh, sorry. Gotta make sure you can see me. It'll look a little bit different, right? If half of our students are in hybrid, that means half of the students are at home, and we can take 2 of those half classrooms and make a special classroom out of it.
Okay.
So they may interact with different kids than their typical classroom or typical specials in the past. But that's sort of how we were able to readjust our schedule to accommodate that.
Just so that it won't be 2.5, 3 hours or whatever it is of all asynchronous. That's the message. Right?
No, and actually, as part of our remote planning days, we've created some templates for checklists to allow students and their families to really get an idea of what that will look like, and put some structure different than what we had in the spring. That on demand is going to be very different now than what we saw in the spring.
Okay.
we saw emergency teaching in the spring. We're going to see some really good instruction.
And I
Synchronous
should have started this first, but I've received a number of emails, as I'm sure we all have, but, you know, to a person, and I want to compliment the teaching staff and you folks as well. You know, the level of activity and learning and we all have realized that, you know, it varies by student because of a lot of different things, but, you know, the staff has done an incredible job at improving, I think, the activity and the level of content available and those kinds of things. Kudos to everybody for that. And am I also correct in that, right, we start here and we go until spring break, and if things are going well, do we have a thought about we might then expand the amount of time that hybrid would be utilized? So in terms of per day or number of days or whatever?
There you go. So those are part of the conversations that we do have during our weekly meetings. So I think it's a natural progression, Wells, to say, okay, how are things progressing? To me, a key component to that is we're looking at our internal numbers.
Right.
So we want to see if our mitigations are working appropriately. You take that into account as more people get vaccinated, or if they choose to.
Yeah.
Does that change circumstances to where we could say, could we bring more kids back? Can we have kids all day? Yes, that becomes part of the conversation.
Right. Right.
And just piggybacking onto that question, I'm sure you're looking at other districts that may be farther down the path, because you provided some statistics for some schools that have incredibly low incident rates, and they're doing something right. So I'm just, again, part of your network is to gather these best practices for schools that have been in some way, shape, or form since August or September or October or whatever it is.
Yes. Yeah.
Can I address some questions from home?
Sure.
Yay.
All right. So my first question is about the new Lake County metrics as they are. I noticed today, unlike yesterday, our website metrics show that they're under construction. Are we going to be putting all of that online as well so that parents can see where they're at without having to do the deep dive into the Lake County websites?
Yes, our website will be updated. We want to make sure we had it so it connected to what Lake County was doing.
Okay. And then Jamie mentioned a hotline that parents can use to report if their kids are having symptoms. Is that going to be the same attendance hotline that normally people call, to call their kids in, or is there going to be a different hotline that will be communicated?
Jamie is confirming yes, that's the same phone number.
Okay, thank you. With the Pediatrust COVID tests that are being done, is there a cost to the people being tested? And who's bearing that if so?
There is no cost to the staff member. It's being covered by the district. The cost, I believe, is $50.
No objection, just asking. Okay. So staff are not going to be penalized for asking for one or what have you, because they're going to have to pay for it. So that's just what I was asking. I didn't hear tonight, but I know we had previously talked about this, and I think Dr. Myers, you had mentioned this early on. This plan has not been, it's been an evolving process as we have learned more, studied more, had better ideas, and learned things around. So I am very much more impressed with this plan as opposed to the one that we were discussing last July. I think that everyone has learned a lot more, and I think that we're in a much better position to put it forward. I know one of the big changes that took place in tweaking the schedule had to do with minimizing the amount of teacher change, the core teacher changes. Obviously, specials, like Dan said, is going to, might move around and might be different. But is it still the goal? And I know it's not 100%, but we're still keeping in place, trying to minimize how many core teacher changes are going to be taking place in these individualized schedules, because I think parents are going to need to know that before they make the final decision on the 24th.
With the current numbers that we have right now, we have to make very few, if any, teacher changes. That's why we say we're working with families as they have requests to change. And that's why we're also saying that on January 24th, we need some sort of, here's where we're going to be until spring break. And then after spring break, when we do the survey, we'll again have to look at where our data is. And I think to what Dr. Myers said, based on the vaccination rate and the comfort level of families, community, and our teachers, can we expand that hybrid offering? What does that look like?
Okay. And then with the, you mentioned that we're now committing to having all the desks being 6 feet apart. And I know that was previously something we couldn't commit to, but I think because we have a better idea of the numbers now, that's why we're able to do that. I know that our classrooms are different sizes in different buildings, but we have that worked out such that if numbers choosing hybrid get to a certain point, then we may have to do some shifting to make that work. Is that accurate?
So I can tell you just as a great example for this question and then also your last question, we have a classroom at Mechanics Grove that I think had 16 or 19 students that wanted to be in hybrid. We didn't want to have to change the teacher. We moved that classroom into a gym space to allow the physical distancing to occur. So we are working with Dave, his team, teachers, and then also the principals and the buildings just to make this all work so that we can do both of those things.
Okay. And then this is more of a clarification because I know the answer to this question, but I think seeing some of the parent questions, I just wanted to make sure that this was discussed as well. So with the schedule that you put up there for the K through 5, for the kids that are in person, the kids at home remote are going to be doing those on demand, their specials, their things like that to fill up that time. And then in the afternoon, it's basically a switch, right? So the kids who were in person in the morning are then going to be doing that same online instruction that the other kids did in the morning in the afternoon, such so that the remote kids then have some of that teacher time remotely, correct?
That is correct.
So we're doing this in order to try to make it so that we're not penalizing either the remote kids or the hybrid kids and trying to give everyone the choice that they want and make it as equitable as possible for whatever choice you make.
That is correct.
Thank you.
I don't really have a question, but I just kind of want to piggyback off of what Wells and Christy and Lisa even mentioned. Most of my answers, or most of my questions were answered anyway from my colleagues' questions. But I want to commend Dr. Myers and your staff. I mean, I don't know how many versions of this we've seen, and I can imagine there's been many more behind the scenes. But from my point of view, this is by far the best one. I think over time we've all learned more about what might work for kids. We learned more about the virus itself, how to put in mitigations. The air filter thing is phenomenal. That's one of my questions I had 3-4 months ago. Once we learned it was a lot more airborne than surface-wise. So just overall, I think we're putting, you've put the best plan forward. It is going to evolve. It's going to change, and I'm confident that you and your team are going to do what's right for the kids as those situations come up.
Have we thought about for those students that do and parents that want to do hybrid at the break point at the middle of the day? Is there the ability to have transportation to a tech hub rather than something else? If that's what they've been choosing.
I'm sorry, I missed a part of it, but I want to
Okay,
make sure. So like, can they go to the park district from
Well,
school?
tech hub, whatever we want to call it. So it could be, I don't know. So have we thought about if somebody's utilizing, I heard
The martial arts place?
martial arts center or whatever, I don't know what these, but would they have the ability to have transport there rather than going to home where potentially no one's home?
So that happens during the school year, and we can confirm that and get back to you, but that happens already during the
I
school
don't
year.
need an answer, but
I'm sorry, I'm in the hub right now, and our resident, like, our district will offer transportation. Yeah, my kid has transportation also, yeah, they just take kids from school to the
I will say those of us at home, we can't hear what's being said in the room.
Did you hear Wells posed the question that if parents have their children somewhere else in the afternoon and they're in the hybrid model, would we transport them to those other locations? The feedback was some of the places already offered it that weren't school district. A couple of parents commented that they were willing to transport their kids back and forth. And we said from a district perspective, we could certainly explore those options. I'm looking at the screen and I should be looking at the speaker.
It's weird.
I know. There's any other questions?
I have a question. Dan, could you go back to the Sandberg schedule? I didn't quite get the difference between remote and hybrid, or the hybrid and the kids learning at home. Could you just go over that really quick?
So, let's see. So, okay, so Monday and Tuesday, our kids are in hybrid are going to be in 2 groups, A through K. They may come in person on Monday. L through Z will come in person on Tuesday. When students are not coming in for hybrid or they've chosen 100% remote instruction, they will log into their class in concurrent education with the students in place. The reason that it switches then Thursday, Friday is to ensure that the afternoon, that students get access to their afternoon teacher in the morning when they're in person. So that's why the change in Thursday and Friday. And I think, I know that I sent a schedule, a whole bunch of schedules actually yesterday. And I think one of those, it's either before or after this one that we shared tonight, has the breakdown of the alphabet for you.
Okay, so, but are the middle school kids in school all day then? I'm confused by that, by the schedule.
So they will go home at lunch. I'm sorry. They will go home at lunch. The whole afternoon is going to be all remote. And the whole afternoon is going to be all remote. Thank you for that clarification.
Okay, thank you.
Any other questions?
This isn't directly necessarily, but it sort of is in terms of the social club idea and trying to connect students and or, I mean, that's sort of an interesting, and I know, yeah. I have a variety of grandchildren that visit my house and do remote stuff and whatnot, and some of them do well, and others not so well, and so that's kind of an interesting idea. I don't know.
So I'll say robotics has been going, yay.
Yeah.
But I will put a shameless plug in for the foundation. We are planning the winter STEAM camps, which we're not sure how, whether in-person, virtual, hybrid, remote. That will be an opportunity for kids to connect in a different way from the regular school day. So I encourage you, I think it's coming out at the end of the month. Mr. Cho will have additional information on that as well.
It could be a social group not related to,
sure.
You know, it could be whatever. I mean, it's just a different, other than trying to learn remote. Okay, thank you. Yep.
Okay.
Thank you.
Thank you. Next topic, Kevin?
Yes, we're moving on to the consent agenda.
We still got we can go over the special ed student services first.
Okay, sorry. Back up to number 3B, student services.
Jamie?
Hi again. So every year at this time, we have the opportunity to evaluate what services from an itinerant contract we feel are pertinent for our students to continue for the following school year. So CEDAL through CEDAL. So CEDAL requests this information by February 1st of every year. That's why I bring the request to this meeting. And at this point in time, how we evaluate what we need is we look at the number of students that require those related services. and look at the projected students coming in from the preschool, because the preschool kind of has a little bit of a different itinerant package. So again, we look at those students, then we look at our 8th graders that are moving along to the high school. And from there, we determine how many services, what allocation of services we need. So in looking, last year, we had a significant decrease from the previous year in the services that we needed. And this year, when I look at the projections of students, coming in and then going out, it's very steady and similar. So I'm requesting that we renew that contract for the assistive technology as well as for the hearing itinerant services through CEDO. So that was included in your packet. And that's again, based on number of students and minutes of students, kind of how that's calculated. Any questions? Oh, sorry, I'm looking at the screen again. I'm supposed to. Sorry. Any questions about that?
Well, so the reality is there are like 2 that we're actually buying services, right?
Correct.
Okay, right.
Yeah, there's lots of things that they offer, but we are very blessed and privileged as a district that we've been able to attract, employ, and maintain like an full-time occupational therapist, many speech pathologists, social workers, et cetera, et cetera. So we have a lot of that ourselves, so we don't need to have that itinerant service in those regards.
And we're still part of the group, the consortium doing the entry evaluations, different.
Oh, the ECAT, the little
ECAT,
ones,
yeah,
yep,
ECATs.
yep.
Sorry, don't know all the.
Yeah, no, I understand, I got you. Yep, okay, thank you so much.
Next up is the superintendent's report.
The one item that we have for tonight, it's the first reading for Press Policy 106. In that report, there are a total of 8 board policies for the members of the board to review. The majority of them are pretty much just footnote additions to anything that happened from legal or small wordsmithing, I'd say. The one that, if you haven't had a chance to look at these, that please pay attention to is Board Policy 490. It's the student activity accounts and the fiduciary funds. That's where they've added the most language. Wells did ask the question, do we have anything else that would come underneath the district, meaning the foundation funds or anything else like that? And the way that's written, that's no. They would stay outside of our organization. So we don't see currently anything else that would change based off this policy adoption. And we're still in compliance with it should we adopt it in its current language with the additions.
Just as a side note for the other board members, Wells and I did attend what's the right acronym?
Illinois.
Yeah, whatever, anyway,
Illinois School Board Association?
Yes,
Yeah,
that
okay.
one. We attended a seminar on the updates, so we feel that we're in pretty good shape too, right, Wells? So there should be nothing surprising for you next go around from us as far as recommendations.
Thank you for that for us.
That's all the reports, sir.
You're on mute. Kevin, you're on mute.
Still are.
Sorry. Okay, now we're on the consent agenda. Does any board member have anything that they would like to pull and vote separately from the consent agenda? Okay, hearing none, I move that we approve the consent agenda as presented.
Second.
Second by someone, I couldn't tell who it was. Maybe it was Mr. Price?
Whoever you want to call it. I did it, but I think a number of us did. So just pick one.
Okay. Secretary, please call the roll.
Okay, so who are we going with as the second?
Mr. Price.
All right, sounds good. Holly,
Aye.
Price,
Aye.
Erickson,
Aye.
you're on. There we go. DuPont. I don't hear anything from Rob. Do you want to,
Sorry, aye.
there we go. Thank you. Finger Hut, aye. Gallegos,
Aye.
St. Clair.
Aye.
Thank you.
Okay, next up is the board action items. We have 3 items tonight. The first one is the return to school in the hybrid model. I move that we approve the return to the school hybrid model as presented by the administration.
Kevin, can I make a quick comment real quick before we vote on this?
Yeah, let's get a second and then we'll do comments.
Okay.
Second by Mr. Price. Comments?
So, listening to all of this, I think the bottom line is that there's not going to be, at this point, there's going to be no plan that's perfect. There's going to be no decision that we can possibly make that is a perfect decision. There are going to be people upset on either side of this. I think one thing that has to happen is we have to make sure that we're following through with all these mitigations that we're talking about. I know that there's a lot of apprehension in some of the buildings from some of our staff that some of these things aren't happening, or that there's been a little bit of a lack of communication with some of this. And I think that definitely needs to be addressed. I'm also not thrilled about the 1 hour less 2 times a week for remote learners at MG in Washington in the afternoons. Because one of the things that I was stressing throughout this was that it was going to be equitable for all the kids, and I can see where people would be upset with that. But like I said, no decision is perfect, no plan is perfect. I will support the hybrid plan because I know that we have a number of our kids that are really struggling and they need to be in the building. And I have seen it personally, just kind of overhearing my daughters and listening to some of the teachers working with some of these kids, that we definitely have a lot of kids that they need to be in person. They need to be seeing a teacher, and they need to be spending less time on their devices. And so I think that we definitely need to give families in our community that choice. But I do recognize that there are some issues with the plan, but I think that that's what we've got right now.
Kurt, is there anything you want to add from personal experience? I don't know, maybe that you had today about hybrid learning?
I actually am teaching remotely because of a ADA accommodation.
Okay, sorry. I didn't mean to call you out.
No, that's okay. That's actually why I am at home rather than being in right now, because I also can see where people might not like the fact that I'm voting for a hybrid plan when I'm not even at the meeting, but that's that. So
yeah,
that's where I stand on this. I see that there are some issues, but like I said, nothing is perfect. And I think other buildings are doing it. I think that we have learned from them. And as long as we follow through on these mitigations that we put into place, I think we need to give families a choice to get these kids back in that are struggling.
I agree with you. That's the one thing I really like about it, is that if you believe strongly one way or the other, there's an option for you to choose. If you think this is a crazy idea, then you can keep your kids home. And if you feel like your student is really struggling, then you can let your kid go to school. So that's one of the things I really like about it.
I will also add that I've kind of gone back and forth, kind of struggling with a lot of the different plans that we've put forth. And I do very much recognize that not all families are experiencing this the same. And, I will say that I have chosen to keep my kids remote, and that is, a choice that I'm making, but I'm not letting that dictate my vote, because I know that not all families are experiencing the same benefits, that mine are. I also struggle a little bit with with the metrics themselves, but I understand that the CDC has changed their approach on a lot of this. The county is trying to adapt in order to move it to each district looking at their own buildings, their own finances, their own ability to provide the mitigation techniques and things that are in place, rather than just dictating the numbers alone. So I am a little concerned that the incidence rates are really high, and they're higher than they were in October. But I know that we now have a lot more at our disposal with the light disinfecting machines, a lot of the upgrades that have been made to the filtration systems. We now know the numbers and where they are likely to be and how to dictate that. And I think that the remote learning techniques have evolved over the course of the year as well. And I am aware of that. I am also struggling with the fact that I know that the teachers are able to get vaccinations here soon. And it seems like it's so close that on the one hand, why can't we wait just a few more weeks? But again, for those families that are really struggling and have been doing this since last March, those few weeks are really challenging for the kids that are really not getting the same education that some of the other kids are. I also I know that as a board, we have looked at a lot of the standardized test data and that have come back, and some of the grade data that, you know, that we've asked for. And that is also influencing my decision, because while I would love to say, hey, let's wait just a few more weeks and get, you know, more of the staff vaccinated, we can't guarantee that everybody is going to get vaccinated who wants to at the time they need to, whether that's teachers or not. And I hate to have those kids who are experiencing, whether it's educational difficulties or mental health difficulties, I hate putting that on them and the families that much longer, because they deserve a choice, just like those of us who want to keep our kids home deserve that choice. So that is a struggle. And I know that that's a struggle that the administration has been dealing with. I know that not everybody is on board with all of the same plan, but I do think that in looking at all of the different iterations of this plan and how it's gone, I think this is the best that we can come up with. It doesn't address everybody's needs. Like Kurt said, there's nothing that's going to be perfect and it's going to solve everybody's problems. Everybody's going to find a fault with it, and nobody's wrong, but we do need to kind of give it a go and try with it, and then keep tweaking it as we find we need to in order to make it work for as many kids as possible, so that we can give everybody that choice. So.
Any other comments? Okay, Secretary, please call the roll.
I'll unmute myself again. Holly.
Aye.
Price.
Aye.
I'm sorry. Thank you. I think it's a delay with the, sorry. Gallegos.
Aye.
Fingerhut. Aye. Erickson.
Aye.
DuPont.
Aye. Excuse
St.
me,
Clair.
aye.
Aye.
Thank you.
The motion carries to go back to school hybrid. Next action item is the fiscal year 22 CEDAL hearing service contract.
I move that the Board of Education accept the Mundelein Elementary School District 75 Superintendent recommendation to approve CEDAL hearing services contract for 1.5 days per week at a cost of $34,912.50 for FY22.
Second, Secretary, please call the roll.
Price.
Aye.
Holly.
Aye.
St. Clair.
Aye.
Fingerhut. Aye. Gallegos.
Aye.
DuPont.
Aye.
Erickson.
Aye.
Motion carries. I move that the Board of Education of Mundelein District 75 accept the superintendent's recommendation to approve the CEDAL assistive technology contract for a half a day per week at a cost of $8,503 for fiscal year 22.
I'll second.
Okay.
Second by Mrs. St. Clair. Secretary, please call the roll.
Holly.
Aye.
St. Clair.
Aye.
Price.
Aye.
Erickson.
Aye.
Fingerhut. Aye. DuPont.
Aye.
Gallegos.
Aye.
The motion carries. Okay, it's time to go into executive session. So I move that the Board of Education convene an executive session at 9 p.m.
Okay.
Secretary, please call the roll.
Holly?
Sorry, wait, I need a second, please. Sorry.
Second.
Please call the roll.
Holly,
Aye.
Dupont.
Aye.
Okay, Erickson,
Aye.
Fingerhut, aye. Price,
Aye, but we need to state the purpose.
Yeah, I know. I'm getting there.
Gallegos,
Aye.
St. Clair, and then we'll let Holly state the purpose.
Aye.
Thank you.
We have two purposes tonight: the appointment, employment, compensation, discipline, performance, or dismissal of specific employees of the public body, and for discussion of minutes of meetings lawfully closed under the Open Meetings Act. When we come out of executive session, we will just act on the executive session minutes. That's all the business left before us tonight. All right, we were back. Oh, this is being recorded. We are back in open session. I move that we approve the December 15, 2020 executive session minutes.
Second.
Second by someone I couldn't tell.
Erickson, okay.
Erickson, sorry. Secretary, please call the roll.
Holly,
Aye.
Erickson,
Aye.
Dupont,
Aye.
Fingerhut, aye. Gallegos, St. Clair,
Aye.
okay, sorry, it's the hard, Price.
Aye.
Okay, I don't know why there's like a delay, so I don't hear anything, sorry.
Okay, I will send out the exit slip probably in the morning. So please fill that out for me. Is there anything that anyone would like to see on the agenda for the February meeting, which is February 23rd?
Yes, sir.
All right.
Yes.
Yes.
I'd like to see a closed meeting item for collective bargaining.
Okay.
For anybody interested in that topic, there is a part 1 and a part 2 IASB webinar coming up on collective bargaining. I'm planning to attend both.
Okay, great.
Brings up, I don't know, probably the second item is whether or not we want to appoint our bargaining team at that time.
Should we probably wait until we have a new board so that I'm just throwing that out there.
Well, my thought is I think we'll have one person that has bargaining experience that is on the current board. And so if we appointed one additional person that's going to be continuing on the board, you could always add a third of those persons who are new to the board if they want to.
And so how many do we usually have as part of that team, since I've never participated in
There's
one?
usually 2 people.
Okay.
Well, we had more than 2 people last time, right?
No, oh yeah, it's right. Well, it was you, it was Fred, me, and you, correct?
Sure, that
Yeah,
sounds like-
3 okay. I just can't count very well, that's all. So I'm a social studies teacher.
I was going to say the same thing. He's a history teacher. He would.
Okay, well, so knowing that, that's what I didn't know the ins and outs, so.
I mean, I don't know any particular reason why we, if
No.
people can.
It makes sense to put it on the board agenda for next time, yeah.
So give it some thought and see what you think.
Great.
And before that, I would want to make sure that we proactively invite the persons that are running for the D75 board to the February 2 equity presentation.
That's a good idea.
Yeah. Dr. Myers, I was going to ask, have you had any conversation with the new board people that are going to be on the board?
No, not yet. What I've got planned is we've got a book, getting prepared. Then I was gonna call in the members that will be coming in from both districts to go over that with them. I'm hoping to have that done by the second week in February and include the dates and stuff for board meetings for them.
Can I also ask, I also noticed that the IASB has a candidate webinar coming up that I know 2 years ago took place as part of the district meeting. So we were invited to attend that, to go to the candidate forum and then to the district meeting. So we probably should invite the candidates, at least give them the link and send them the information if they want to participate in the IASB candidate webinar. The boardroom seems to be muted, if that's on purpose or not, not sure. But
Okay, anything else anyone would want to see at a next board meeting?
So I don't know if we want to discuss, I've been trying to foster some better communication and there was some ideas thrown out and I've got feedback from some of you. Did we want to talk like at that time about, you know, streamlining questions, sharing how we could share beforehand? Some of you have said it is helpful to see what other people are thinking so they can recraft their questions. So, you know, just I had suggested, you know, maybe a Zoom or a shared document that we could all add to and then submit, you know, you could grab it on us or on us. So, you know, that's the kind of thing we've been kind of talking about. You know, I find it very valuable to hear what everybody else is asking because maybe I'm focused on certain issues, but seeing it in advance. And then I can craft my questions differently.
So is that after the board, after the board packet has been sent?
Yeah.
So
Yeah.
create a Google Doc.
Yeah.
Where you can place.
So we can all, but then we had questions about would that violate any open, or would it only violate it if 3 were in there at the same time?
As long as you're not communicating in there,
No.
right? You're posting questions, right?
posting
You wouldn't
questions.
try
Yeah,
to
we wouldn't be-
respond to what somebody asked.
And we could put that at the top, you know, do not.
Right.
I won't give anyone editing rights. It'll just be posting, post your things, you can read it, and that's it. If the minute you begin to communicate, you violate.
I can't hear what Anna is saying.
We'll look into creating that shared Google Doc. So
Okay.
that questions you have prior to the board meeting, you can just put your questions in that Google Doc so you can see what each other's saying. And we'll make sure we can do that first. And
Right.
if we can't, we limit it so there can't be communication that happened in that document. Meaning like if you knew an answer to something, Christy, you wouldn't go ahead and respond to it.
Of course, no. Okay. And I don't know if this is an item for the agenda or just a follow-up, and I guess just finding out if anyone else wants the follow-up or just me. I know that I was the one that asked the question about the performance or the standardized testing or whatever achievement tool that we use for K through 2, because I know we were given the STAR information for 3 through 8 or whatever, but we were not given any information for K through 2. And I saw that the response was, we have a different achievement and growth tool. And so I said, well, can we see that? And then it said, well, I need to know what you want to see. Well, I don't know what the K through 2 tool is, so I don't know what to ask for, but I would like to see that. But if anyone else would like to, then I would suppose that would be more broadly, maybe in a Friday update or something. It may not need to be at the board meeting, but just following up on that.
And I think maybe this is part and parcel of what we talked about, Kevin, just having standard metrics that get reported, you know, and understanding where it comes from. You know, it could be a very simple grid quarterly, you know. And again, that ties into literacy and the bilingual program overhauls. And it just sets a nice standard kind of pattern of data and what to expect. You know, where it's coming from.
And maybe, and I know, Lisa, you were just suggesting quarterly as something, but since I think we do 3 different testing periods throughout the year, maybe doing it whenever those results come back so that we.
Yeah, whatever makes sense, like. You
Right,
would ask-
right. No, I know, I'm just throwing that out there.
Or these different tests, yeah, whatever makes sense.
can do.
Anything else?
Yeah, and, again, I don't, the urgency and the time, but I had, questions around I think it was called, it started with an M. It was MTSS, what is that? Can we hear a little more about what that is?
It's
At
exactly
some
what you and
point.
Christy were just talking about with the test and when we're giving them to assess the kids throughout the year. So those two go hand in
Okay,
hand.
okay. So, because it seemed like a support model of some sort.
Yes.
And then there was greens and yellows and reds and I was getting confused.
Yep.
It talked about building goals that seemed to be different and percentages.
Yep, so, the MTSS model, that's the multi-tiered system of supports. And that's the regular regiment. We assess our students to see how they're progressing. And then based off how they do, we put in interventions for them. We are redesigning that for this upcoming year. So that would be something that, like what you received in that Friday update was where we are right now. That should be ready to roll out definitely before the end of the year. We do need to have some staff get training on that process. So that is on the docket to bring back to you when we can say, this is it.
Okay, because it was just a little out of context for me because I had never seen that before, so.
Yep, understood.
Kevin, I had a question. Do we, as the board, do we see the employee leaves and accommodations that Shane talked about earlier?
If they won't be official until they are actually not going to be in the building, but I would assume, Kevin, they're on the personnel report.
Okay, so next month or March?
I would anticipate it'd probably be next month.
Okay, I was just curious because there was so many of them, so I just wondered.
Need to follow up too. I think those are the ones that we know would be approved, but since it hasn't come to where they need to take that accommodation, that we haven't brought them forward yet. That's my assumption right now. I'll follow up with Shane.
Okay, thank you. Okay, anything else for the good of the group? I move to adjourn.
Second.
Second by Mr. Erickson. Secretary, please call the roll.
Holly,
Aye.
Erickson,
Aye.
Fingerhut, aye. DuPont,
Aye.
St. Clair. Gallegos. Price.
Hey.
9:47.
Well, you can hear in my voice. I came down with a sore throat today. That's why I'm not in person.
Thank you.
Thank you.
I couldn't pass